The main background is that for patients with early HER2 positive breast cancer, there is actually an ongoing need to identify prognostic biomarkers that can guide treatment de-escalation. So we took advantage of the ShortHER trial platform. The ShortHER trial is a trial that tested the non-inferiority of 9 weeks as compared to 1 year of adjuvant trastuzumab combined with chemotherapy for patients with early HER2 positive breast cancer. And also there was a de-escalation of chemotherapy in the short arm. So this is a large trial that included more than 1,250 patients, and we first published a few years ago the primary disease-free survival analysis. Unfortunately, we were not able to claim the non-inferiority of the 9 weeks as compared to the 1 year of trastuzumab, but we recently published on JCO the 10-year updated overall survival analysis that showed superimposable outcomes between the two arms. So our biomarker of interest in this present analysis is to test the role of tumor-infiltrating lymphocytes in the context of the ShortHER trial. And we analyzed TILs on a cohort of 866 patients from that trial. We previously published a first analysis showing that patients with high TILs, with a cutoff of 20%, had a significantly better distant disease-free survival as compared to patients with lower TILs. And this analysis had a median follow-up of 6 years. Next, we also demonstrated a significant interaction between TILs and treatment arm, meaning that patients with high TILs, with low TILs, derived a significant benefit when treated in the long as compared to the short arm, and patients with high TILs actually had a very good outcome irrespectively of the treatment arm, with even a numerically better distant disease-free survival when they were treated in the short arm. So here at ESMO, I presented this analysis with an updated follow-up, with a median follow-up of 9 years, so 3 years longer as the previous one. And we now included both distant disease-free survival as clinical endpoint with updated events, and also we are now able to analyze overall survival due to this longer follow-up. So first, we demonstrated that higher level of TILs are significantly associated with both distant disease-free and also overall survival in multivariable models. So TILs are an independent prognostic factor even for overall survival. So for every 1% increase in the level of TILs, there was a 3% reduction in the risk of a distant disease-free survival event and a 2% reduction in the risk of death. And this was highly statistically significant in multivariable models. We also analyzed compared survival curves for patients with high versus low TILs according to different cutoffs levels. So 20%, 30%, and 50%. And actually, we observed a significantly better outcome for patients with high TILs as compared to low TILs for all these different cutoffs for distant disease-free survival. And also, we confirmed a better overall survival for patients with high versus low TILs at the same cutoffs. Specifically, to give you just an example, the 10-year overall survival rate for patients with high TILs with at a 50% cutoff was as higher as more than 98%. And finally, we were able to confirm at this longer follow-up a significant interaction between TILs and treatment arm for distant disease-free survival, with an evident benefit for the long versus short arm for patients with low TILs, and a numerically better distant disease-free survival for patients with low TILs treated in the short arm, for patients with high TILs treated in the short arm as compared to the long arm. And also, we demonstrated that results of the same analysis, considering overall survival as the main endpoint, pointed exactly towards the same direction, with a borderline test for interaction.